In this video, we will discuss about obesity and weight loss. Obesity is defined as weight above normal range. Obesity is associated with higher risk of death as well as host of medical problems. Losing weight to the normal range will decrease that risk. In this video, we will address issues related to obesity and tips related to weight loss. How do we quantify obesity? One way is to calculate BMI or body mass index. BMI is defined as body weight in kilos over height in meters square. Normal BMI is 20 to 25. Overweight is defined as BMI of 25 to 29.9. Obesity is defined as BMI of 30 or more than 30. Severe obesity is defined as BMI of 40 or more than 40. Other measure of obesity is higher waist circumference. Waist circumference of more than 40 inches in men and 35 inches for females is considered high and confers higher risk even when BMI is within normal range or mildly high. In Asians, waist circumference of 35 inches in men and 31 in female is considered abnormal. In the Asian population, waist circumference is more important than BMI-based risk, even if BMI is within the normal range. So what is the problem of being obese? There is increased risk of mortality or increased risk of dying. There is increased risk of type 2 diabetes, increased risk of high blood pressure, increased risk of cholesterol, higher risk of heart disease, higher risk of stroke, higher risk of cancer. There's a higher risk of sleep apnea, depression, poor quality of life, poor mobility, poor function, higher incidence of fatty liver. Higher the BMI, higher the risk of disease or mortality, as seen in the picture here. How do we treat obesity or overweight state? The ideal BMI is between 18.5 to 24.9 and the waist circumference in the normal range. Best way to do is to bring changes to the lifestyle, which include diet, focusing on the high quality diet, focusing on eating whole foods which are plant-based and with high fiber. Avoid processed, refined food, fast food, sugar and food with preservatives. Plant-based diet, Mediterranean diet and the DASH diet are some of the good diets. Please refer to my previous video on the diets, the good, the bad and the ugly. Focusing on the quantity of the diet, decreasing the calorie intake. Most people tend to lose weight if there is a calorie restriction of 800 to 1200 calories in a day. Increasing the fiber in the diet will make you full without increasing calories. In addition to focusing on what to eat and how much to eat, focus on when to eat. This is also very important. Follow time-restricted eating schedule. Eat only 8 to 10 hours in a day and fast rest of the time for 14 to 16 hours. This is a powerful method to help with weight loss. For more information on the TRE or time-restricted eating, watch a video that I made explaining it. Other modality or changes in lifestyle includes exercise. Dietary restriction helps more with weight loss than exercise. However, exercise is important to maintain that weight. Following a dietary plan and behavioral therapy was more successful in weight loss compared to a supervised exercise program. 30 minutes or more of aerobic exercise 5 to 7 days a week will help to maintain weight. More the exercise, more the benefit. More exercise is needed for people who are not able to eat a calorie-restricted diet. A combination of aerobic and resistance training is required. Behavioral therapy helps with weight loss. What kind of a behavioral change do we need? Monitoring food intake using a food diary, consulting a registered dietitian, nutritional counseling, setting goals like 1 pound a week weight loss, having a defined meal structure, eating mindfully, savoring all the taste and texture and chewing slowly. This will automatically slow down on the eating process. Fill half the plate with fruit and vegetable. 80% rule. Stop eating when your stomach is 80% full. This is what Japanese people do. There's a lag between when you are actually full versus when you feel full. When you feel 80% full, you stop eating so that in an hour you feel completely full. Use smaller plates. Use small cups. This will automatically decrease calorie intake. Keep all unhealthy foods out of reach and out of your sight. Keep only healthy foods like fruits and vegetables within the reach and sight of the refrigerator. Research shows that we tend to eat more whatever is in our immediate sight. Drinking water rather than sugary beverages also helps. Using your weight scales on a regular basis. Financial rewards help with weight loss. Social support Cognitive restructuring. Let us say you are tempted to eat something unhealthy like a cookie or ice cream. Instead of regretting over this, go for a walk or exercise. Having a strategy in place as to what to eat before going to a party or a social gathering. Learn to say no firmly. Identify stressful situations that make you eat. Work on stress reduction activities such as deep breathing, meditation, and mindfulness. These practices will help increase your willpower to stop from eating unhealthy foods. Other treatments that will help include drug treatment, gastric banding, intragastric balloon, and bariatric surgery. Liposuction is not good. While it removes fat, it does not improve risk factors for heart disease. To improve these parameters, one needs a negative energy balance induced by low-calorie intake. There are no shortcuts, unfortunately. The only way to metabolic health is through proper diet and exercise. Dietary supplements do not help with weight loss. There is no evidence to support their use. I hope you like the tips for weight loss. In conclusion, obesity is associated with a host of chronic diseases. Addressing obesity with proper lifestyle changes that include diet, exercise, and behavioral therapy, as discussed in the video, is very important. Thanks for watching this video.